Of that, we're going to talk today about something that may be another reason that you're apprehensive about getting a hearing device, and that would be stigmas.
Absolutely.
So what are the main stigmas when people come in and they say, I've been hesitant to do this? What's the stigma?
Yeah, so, interestingly enough, a lot of people think that the reason that people don't help their hearing is because of the high cost of hearing instruments. That's actually not the case at all. It really genuinely is attached to the stigmas that society has created around hearing loss and wearing hearing instruments. And there was actually a study in 2010 where a researcher found that the three main factors relating to these stigmas are your alterations in self-perception. So, people don't want to feel like that they have a disability. They don't want other people to feel like or treat them any differently. We all want to be the same. We don't want to feel like we're on the outside or different at all. So that's another one. Ageism, that's a huge one where people are like, well, only old people need hearing instruments, or only old people wear hearing aids, or I don't want to feel old. It's that grief of getting older. But what I will say about hearing loss is it doesn't discriminate. Babies on up to our elderly patients have hearing loss. So, what I would say to those people are, do you think that baby infant born with hearing loss is old? No, it's not. It's just a loss of your sense, just like I wear glasses, because I can't see well. Hearing instruments help hearing loss for people who can't hear well. It has nothing to do with age. And then another thing is just vanity,
Yes.
People don't want to have this outward representation of the loss that they have. They don't want to bring attention to themselves.
So you may have already answered this, but to be clear, so these folks who come in with the stigma, how do you get them past that stigma? I'd say the first one you mentioned, which was cost, you can show them, hey, it's not that costly.
Right.
Here's the option. How do you get past the other stigmas like vanity? I'm going to look like I'm old. So what kind of conversations do you have, Doctor?
Right. Yeah. So really, genuinely speaking, one of my big taglines that I tell people is I ask them to think about their hearing loss without hearing instruments. And oftentimes, by the time they've come into me, it's because it's gotten to the point where they don't want to, they're at the point where they're like, I don't want to deal with this anymore. So they've had people point it out to them. Their wives are irritated because they're like, huh, what'd you say? Their friends are joking on them saying, you need to get a hearing aid. So what I tell them is I say, an untreated hearing loss is much more noticeable than today's hearing aids. So it really is true. We have a lot of discrete options, so their untreated hearing loss and the impacts of that are much more noticeable than the hearing aids. Another thing that I do is I'll give them two mirrors. I'll put a demonstration hearing instrument on them. I'll give them two mirrors and ask them to look at the hearing instrument. And oftentimes they say, I can't even see it. I say, exactly, exactly. If you can't even see it, nobody else is going to see it, So that's a big one of how I help them through kind of the vanity. And overall, a huge part of it is education, educating them about the impacts of hearing loss so that they can be empowered to make a decision to improve their health care. The interesting thing about hearing loss is people do not understand how impactful it is to your quality of life. People who have untreated hearing loss are more than double, their incidence of depression is more than double the national average. Untreated hearing loss costs our nation $133 billion a year.
Wow.
And oftentimes, people don't understand how it can impact your whole system. One of the reasons they think it costs $133 billion a year is because patients don't want to go to the doctor because they're like, I'm not going to be able to hear what they say anyway. I can't tell you how many patients tell me that. Like, I have to have somebody go with me to the doctor so I can hear what they're saying. Or they misunderstand instructions of how to take medications and things of that nature. So just really education is key. And then there are also some organizations that people can join to help them kind of, overcome their own personal bias against their hearing loss and kind of get involved. I tell people to really become an advocate for themselves. Having hearing loss is no different than having vision loss. It really isn't. And so it just genuinely is about meeting them where they are, but also helping them just become empowered with the education.
You know, Dr. Sweeney, what really resonates with me is we can talk about the serious implications and how a loss of hearing can affect your mental capacity, et cetera, cognitive issues. But I think the one that really resonates with most people is just quality of life. When you can't converse with your friends at parties, when you're left out of a story because you can't participate, ultimately the quality of your life goes down. When you're afraid to go out socially because, like you said, maybe your friends make fun of you, or you're going, well, I can't hear them anyway, I can't participate, that's a quality of life issue. So, and that's so important.
No, it's so important. It really does. Like, my heart, like, genuinely bleeds for these people. I just actually had a gentleman in my office yesterday, and he's this, you know, gregarious, like, louder gentleman that really likes to talk, and he likes to tell you his story, but he has a significant hearing loss. And what he told me was, he said, first of all, he talks really loud. So, and that's oftentimes happens with hearing loss because you can't modulate your voice, you can't hear it. And he said, I've stopped talking. And he said, and I also have avoided and retreated social situations because I can't hear.
He's not himself anymore.
He's not himself anymore.
Oh.
And you become depressed. And then depression, just like hearing loss, can lead to dementia. I mean, it's all of these comorbidities that happen with the untreated hearing loss, but just the overall quality of life is so impacted. I mean, I have these people that come in that they've never really heard their grandchildren's, you know, the actual voices of their grandchildren. They can't understand them speaking. And it just really is sad that the stigmas that society has created really does impact people's decision of moving forward with hearing instruments. The statistic is, once somebody notices they have a significant hearing loss, it typically takes them 7 years to seek treatment. So,
well, hopefully we've added a little bit of urgency here.
Yeah.
So here's some good news for you as well. This is all good news. Louisville Family Audiology is expanding their services. Let's talk about that. You've got a new office.
Yay,
Congratulations.
I know. I'm so excited.
You should be excited.
Yeah.
You can help more people.
Absolutely.
So tell me about your new location.
Yeah. So when I started this, you know, journey about almost 6 years ago, it was just me and plugging right along, doing it all. And I was like, I really want to grow this. You know, I have a deep passion for it, and I have a very clear vision of what I want hearing healthcare to be. And so, and I think because of that genuine nature, and also the fact that I have an awesome team of audiologists and support staff, that, you know, we've become successful. And because of that, we're able to grow. So we are taking our services to Oldham County. We're going to be in Crestwood. The official opening date is November 8th. And we are so excited to be able to bring that excellent hearing health care to Oldham County.
All right, Dr. Sweeney, I hear you loud and clear. If you do not hear her loud and clear, that's a reason for you to go to Louisville Family Audiology. Thank you, and congratulations
yes,
to you.
Thank you.
All
Thank
righty.
you.
Coming up here, you know, Mom and Dad.